So the surgery center, we do have the Mako robot now. I've been using it for about 5 years. I used it when I was in fellowship, and then I used it when I came here. Initially, I just did the hip replacement and the partial knee replacement. And then about 2 years ago, we got the software so we could do a total knee replacement. The advantage of using Mako is precision, right? So every patient gets a CT scan, of their hip or their knee. Based on that scan, it creates a 3D image where we can plan our component size. And then on the day of surgery, the anatomy of the patient is mapped out. And then I can change my plan where those components are going based on the patient. So everything is very custom. And then once I'm happy with how everything is on the screen, then the cuts are made. Prior to that, we would put standard blocks on, make cuts, and then sort of go from there. Maybe release a ligament here, downsize a component, just depending on the patient, change the poly. But with the Mako, once my plan is executed, I rarely have to change anything. I think the biggest misconception with the robot is that I'm not on the field and it's doing the work. It's different than other robots where I'm on the field, we bring the robot in to make my cuts, then it goes off the field. And then just having the software, like I'm always looking at this plan, and because there are arrays attached to the femur and the tibia, I can constantly see what my motion is, how much laxity there is with the knee, and I can subsequently make adjustments if I need to. But it's me on the field making the cuts and not the robot. So this is the femur and the tibia, okay? This is like from a frontal view. This is, again, here's a lateral view of the tibia, and then here's a view from above the tibia looking at it, and this is a picture of the knee with it flexed, okay? And so, it gives me 3 planes here where I can see where these implants are sitting, if I need to make some adjustments and move my implants, maybe I need to go to a smaller implant. But I see all these things on here, and this is based on the anatomy, so I already know, okay, this is this patient's knee, this is a good fit for that patient. I have a probe in my hand, and I map out the anatomy, and so that communicates with these cameras up here, and it checks that against the CT that we previously ordered. And so it knows the patient's anatomy. So every move I make is based on that anatomy. It's based on these implants that we've already preoperatively planned. And then I check the patient's leg. Soft tissue plays a role as well. And so again, based on the anatomy, based on their soft tissue, I make adjustments to the boning plan, to the implants. And this is all before I make my cut. So I have an idea, very accurate idea, how this knee is going to look and function before I even make a single cut. And once I'm happy with the plan, then I use the saw, which is on the arm over here, and otherwise I'm doing the same case. I'm making my cuts, putting the implants on, which is very accurate. With a balanced knee, it is possible for implants to last longer because one side may not be wearing out more than the other. The other advantage is these implants are better than they've ever been. They have much better wear properties. The whole goal is to give a patient a joint replacement that lasts them the rest of their life. Nobody wants to go back in for a second time.
BusinessJournalDaily.com 3 Minutes With is brought to you by...
I want to retire knowing we did it right. We want...
to know that it's been worth something.
It's worth everything.
Be intentional about your worth. Farmers National Bank Wealth Management.